So, our topic for today is what to do before egg freezing. So, let's get started. So, you've decided to freeze your eggs. Perhaps it's due to not meeting your partner in crime yet. Maybe you have a medical condition that's impacting your fertility and you need to freeze them for whatever reason. Perhaps you'd like to freeze them while you're still young, or maybe there's some other type of reason. But what next? Should you actually prepare your body before you actually go ahead and freeze your eggs? Should you boost your fertility? Should you support egg quality? And how can you increase the chances of a successful egg retrieval, so the amount of eggs that they actually collect? So let's discuss what you should be doing before egg collection and why it's important and the benefits of doing that. Hello everyone, I am so thrilled to be here today. If you have any questions as we go throughout the live today on Instagram or Facebook, please pop them in the comments box down below and I'd love to answer them as we go through. Otherwise, you can just pop questions in later on and I'll go back and answer those for you. If you're enjoying the content as well, just be sure to hit likes and loves. I really appreciate that, and it shows me that you're actually enjoying the content as well. So for those of you that don't know me, my name is Michelle Cooke. I'm a hormone and fertility naturopath. I'm a natural fertility educator, and I'm a naturopathic emotional release practitioner as well. And I'm the owner and founder of Reproductive Wellness, which is a clinic based in Melbourne, and I see patients online and face to face. So let's get started today. So what's involved in egg freezing? So this is it in kind of a bit of a nutshell, okay? So the process is known as EFT, or elective fertility preservation. And it's when unfertilized eggs are actually removed from your ovaries and put on ice, but not literally ice cubes. I'll explain a bit more about that. And they're stored for use at a later date, okay? So when you're actually ready to use them, they'll actually defrost or thaw those eggs and then attempt fertilization in an IVF situation using the sperm through an IVF procedure. Once fertilized, they'll actually implant them then into the uterine lining. So to do this, of course, you have to actually go through the IVF process, both to actually collect the eggs and then again once you actually want to go ahead and use them. So they'll start by giving you synthetic hormones and medications over about a 10 to 12 day period. And that's to stimulate the growth and development of your follicles, because normally in a normal scenario when you're actually ovulating, it's usually the chosen one that will be ovulated and it will just be the one egg. So this whole process is actually going to be, or the purpose of it is to be making more eggs, so multiple eggs in the one go. So that's generally why you'll do this. And it will make you ovulate as I suggested and produce multiple eggs in the one cycle, okay? Then it's time for egg pickup. Hey there, sexy egg, what are you doing? No, not like that. Actually, egg collection. So it's just another terminology of egg collection or egg pickup. So that's when your eggs are literally collected from your ovaries. So what they will generally do is insert a tube in through the vagina, which contains a fine needle inside, and that fine needle will actually penetrate through the vaginal wall into your ovaries and actually take out the eggs that way. So they usually do it both sides just to collect a number of different eggs there. And generally the procedure is done under general anesthetic, or you might be given a sedative during the procedure as well. Light anesthetic. Now, once the eggs are collected, they are frozen very quickly. And there's a process that will remove all the fluid surrounding the eggs so that you're not getting sort of, what do you call it, kind of crystal formation. You know, when you freeze something at home and you get kind of that crystallization. They want to avoid that as much as possible because it affects the egg quality. So then the eggs are stored for a number of years or whenever you actually plan to use them for a future date. So they're essentially cryogenically frozen. So like Mr. Bigglesworth and Dr. Evil, kind of like that. So they're frozen and then you can access them at a later date as well. So the process from start to finish when you're doing an egg freezing process is generally about 14 days. So it's kind of replicating that of your follicular phase, isn't it? Because day 1 is the start of your period, and then the follicular phase is from day 1 of your period through to ovulation. So that's essentially what they're trying to replicate using those synthetic hormones in order to collect multiple eggs instead of just the one that you would normally have through a natural cycle. Now, the important thing to remember about egg freezing, okay, is your age. So when you reach 35, obviously the quality of your eggs will start to decline. So the younger that you are in terms of egg collection, the better, if you're thinking about freezing them, that is. So the other thing is getting your eggs collected and used at a later time to be fertilized by sperm is not a guarantee. It's not a guarantee that it will be a successful fertilization, a viable embryo. So an embryo is after the egg has actually been fertilized, it turns into an embryo. Whether implantation takes place and whether it's going to actually be a viable pregnancy. We need to remember that doing IVF doesn't guarantee success. It doesn't guarantee pregnancy success, fertility success, a successful cycle. Because you're simply just putting those key things together. So you're putting an egg and sperm together without any consideration of the quality of those and the actual health of those as well, which is really, really important. Because if an egg or sperm is of poor quality or poor health, this can lead to an unsuccessful IVF cycle. That's the hard truth at the end of the day. So there's lots of things that you need to actually consider. So what is the nursery environment like for my eggs? So your nursery is essentially your body because that's what your eggs are living in. What is it like for them growing up in there? Do you drink excessively throughout the week? Do you smoke cigarettes, marijuana, or use a vape? What kind of things are you eating to actually support egg quality? Do you eat junk food? Does your diet include a lot of high sugary foods? What kind of toxins are in your home? Do you use things like bleach to clean, but it's actually at the detriment of your fertility and hormone balance? And do you look after your vaginal health? Because that's particularly important for fertility and quality of eggs as well. Your eggs, or oocytes as they're more affectionately known, need particular fundamental things to be able to develop and mature and be in tip-top shape. So quality-wise I'm talking about. Because essentially the eggs are the house to your baby's future DNA, okay? So this contains precious genetic material that determines your baby's characteristics, so what it will look like, whether it'll have blue eyes or brown eyes, what hair color they'll have, etc. If this is damaged, if the DNA found in the eggs is damaged, so if your eggs are of poor quality, This risks your baby's mental and physical health, which is really detrimental for that baby to be through childhood and potentially through adulthood as well. So your ovaries and eggs actually need adequate nutrients from your diet, and in some cases in the form of nutritional medicine supplementation as well, to correct deficiencies, because if you're deficient in a mineral or vitamin, it can be very difficult to actually correct that through diet. Our soils in Australia are very deficient in some minerals, for example, things like magnesium and selenium, for instance. And there's also a lot more processing involved in the foods that we eat these days. And the food is made to last longer, but then there's also the consideration that it can actually be more depleted in minerals and vitamins. So a healthy, good quality egg or oocyte will mean that you'll have a healthy embryo, because that's what it turns into after all, which means a better chance that that embryo will implant in the uterus, resulting in a successful pregnancy establishment. Did you know that what you do 120 days prior to conception, or in your case prior to egg freezing, will determine whether conception takes place, whether there's successful implantation, and pregnancy will arise? So let's talk about the success rates of egg freezing for a minute. So the success of your eggs becoming a baby is largely dependent upon the quality of your eggs. So we need to kind of look into the future as such, because essentially that's what we want to be doing with the eggs, don't we? We want to use it for a successful conception in the future, don't we? So it's largely dependent on the quality of your eggs, your age when they were collected, and the number of cycles that you can afford. So you'll actually see why in a second. So this comes from the Victorian Assisted Reproductive Treatment Authority, or the VARTA website, and they say that to have an 80% chance of having a baby and you are 35 years or younger, you would need 14 eggs collected. If you're 37 years old, you would need 24 eggs collected. If you're 38 years old, you would need 27 eggs collected. So from each hormone stimulation in Victoria, the average is 35 years or younger is 13 eggs. So remember, if you need it to be an 80% chance, if you were 35 years or younger, you would need 14 eggs collected. So that's not too far off. So that gives you an indication there. And the average in Victoria for 35 to 39 years of age patients, 10 eggs are generally collected. So remember when we spoke about if you're 37 years old, you'd need 24 eggs to be an 80% chance. So that gives you a bit of an understanding there. So you can see why it's so important to improve the quality of your eggs, because as you reach 35 years old and above, your egg quality declines. So it's extremely important to improve this, to improve those success rates. So you're probably thinking, well, what should I do prior to freezing my eggs then? Well, you need to prepare the body to be as fertile as it can be, making sure that the nursery, so the home to your eggs essentially, where your eggs are growing up and maturing, that what's in there is you're giving them what they need, you're supporting their health and quality, you're increasing the chances of a successful egg yield as well, because if you improve the quality, you're going to end up responding better to the IVF medications, and they're going to end up with a better egg collection as well. So you end up with an increased number of eggs too. And to help improve your chances of conception when you decide to actually use them down the track, because that's the whole point of doing it, right? So the best way of doing this is through preconception healthcare. So this type of treatment is done prior to conception, or in your instance, I would suggest doing this prior to actually going through the IVF procedure to actually collect your eggs. So we want your eggs to be the prized eggs. So like on Willy Wonka and the Chocolate Factory, we've got the golden goose eggs. We want those eggs to be top notch like those ones. So more like the Lindt type of chocolate, probably not so much the Cadbury type, if you're getting my gist there. So what is preconception healthcare? Well, it's a specific treatment plan that takes place in the preconception health period, so before conception arises, and it's used to boost your fertility, improve egg quality, improve your response to IVF, also improve the number of eggs collected, and increase your chances of having a baby. So the main focus is optimizing egg quality, the function of your eggs, maturation and development, and therefore a healthy embryo to assist with improving fertility and your ability to conceive. I've just written some notes here so I stay on track. So what's involved is removing toxins from the home, addressing nutrient deficiencies, sorting out hormone imbalances, because that's really important, because if your hormones are too high or too low before you actually go in for the IVF cycle, sometimes it can be cancelled because it's not what they expect and they want you to actually get a good outcome. So it will be actually cancelled as a result of that. Making sure that you're eating and drinking the right things and avoiding things that aren't good for fertility. Addressing health conditions that are impacting your fertility, improving the chance of getting a good egg yield from your egg collection. If you improve general health, of course that's going to support and improve reproductive health as well. The health of your eggs are reflective of the nursery that they're growing up in. Don't forget that. So the nursery is your body. And think of it like, if you're baking a cake, you need all the ingredients. So all the ingredients that the egg needs for it to actually develop, mature, and be of good quality. If you don't have all the ingredients for the cake that you're going to make, it's not going to turn out that well. So, in the same way, the egg needs certain things to mature, develop, and be of good quality. So it makes sense, doesn't it? And the treatment time is a minimum of 120 days, and that's not just some random number pulled out of nowhere. It's simply following biology. So it takes eggs 120 days to actually develop and mature. So it's following that time frame. So we're just making sure that during that time frame, the eggs actually have what it needs to do what it needs to do to grow, develop, to be of good quality, etc. And for your hormone balance to be in check as well, because that influences egg development and quality, etc. as well. Furthermore, if you have a hormone imbalance, this takes generally 3 cycles to correct that. If you've got a nutritional deficiency, that takes 120 days to actually be replenished. So if you're low in vitamin D, for example, that will take 120 days to actually correct itself. So the body does things in its own time. You can't rush it. It's just nature, and that's how it goes with the body. Now, the Foresight Association has 35 years experience in preconception healthcare. And they've done several studies using preconception healthcare before doing IVF procedures, and they've assisted couples using diet and lifestyle and addressing nutritional deficiencies as well to improve IVF success. So why would you bother doing preconception healthcare? Well, there's so many benefits to it, and it makes sense to do it because in this modern day we're exposed to so many things that our grandparents weren't exposed to. So things like pollution, herbicides, pesticides and fungicides from farming, poor nutrients in our soils which impact the mineral and vitamin content found in our foods, polluted water, more sedentary lifestyle, poor eating habits, poor food choices, stress is another huge one. And the impact of radiation and blue light, for example, from things like phones, tablets, computers, laptops, etc. And a good example of this is scrolling before, very late at night before you go to bed will actually impact the production of melatonin. So melatonin is your sleepy time hormone, which of course is going to help sort of improve you getting to sleep and having a good quality sleep. But in terms of egg quality, melatonin is actually really important because it's actually an antioxidant which will protect your eggs and improve the egg quality there. So the ideal recommendation from scientists is actually to stop scrolling sort of 2 hours before bedtime if you can, or at least 1 hour before, to actually improve egg quality that way. So very, very important things to consider here. Heavy metal exposure is another huge one as well. And all of these things will impact egg quality, your ability to conceive, and for a viable pregnancy to occur. So the benefits of doing preconception healthcare, there are so many. So egg quality and health, the number of eggs collected because you'll respond better to the medication. Your endometrial lining as well, it will help make it nice and thick for implantation to happen. Hormone balance, because as I mentioned, that's extremely important even if you're doing IVF. For successful fertilization, implantation, and pregnancy establishment. And preconception healthcare not only improves your chances of conception, but it also improves the health of 3 generations to be. So it's called epigenetics. There's lots of research on that. And also it's going to help improve, or increase the chances of having a healthy pregnancy, a healthy birth, a healthy postnatal experience, and of course a healthy baby to be. So the growing baby relies on your nutritional status for growth and development. So you need to be topped up nutritionally before conception, otherwise yourself and your baby will suffer as a result. It reduces the risk of miscarriage, stillbirth, small for date babies, malformations and defects, so birth defects. So very, very important stuff. So you're probably wondering, well, can a naturopath actually help with preparing for egg freezing? And the answer is absolutely. So especially a naturopath that specializes in hormones and fertility, which is what I do. So in my clinical practice, I use herbal medicine, nutritional medicine, lifestyle and dietary advice. We also look at pathology tests, but a lot differently to what a GP will. So I'm looking at optimal ranges. So you'll have a pathology range which is very broad, but I'm making sure that you're within those sort of optimal ranges of that fertility or pathology range. I also teach you how to chart your cycle as well, which is extremely important to recognize how long your follicular phase is and how long your luteal phase is. And this sort of gives us a bit more of an understanding of which hormones might be low, dependent on your kind of cycle length or length of those phases as such. So basically, I also use a technique called Naturopathic emotional release. So this looks at any underlying emotions or stressors in relation to fertility. And basically, this tool will look at muscle testing and looking at Chinese meridians. So there's different meridians that lead to different organs in the body to see if there's an underlying emotion there or a stress that's sabotaging your fertility, and that's extremely important. There's a lot of underlying emotions in terms of fertility in my experience, so it's really important to go deep with that and see if there's anything there and clear it off. So basically, you go in and you find that underlying emotion in the meridian, and you'll clear that off using emotional freedom techniques. So sort of tapping and clearing it that way. Okay. So have we got any questions before I disappear for this evening? I'll just double check on Instagram and Facebook just in case. Okay, not for the moment. So if you do think of anything perhaps later on, you can pop it in the comments box and I'll answer it for you. Or if you're a bit shy, you can send me a DM or a PM and I'm more than happy to answer that for you. So if you actually need help with this and you would like some support before you go ahead with egg freezing to improve the quality and health of your eggs and improve a successful egg yield and improve the chances of conception, I would absolutely love to help you, and I'd like to invite you to book a free discovery call. So the link is in my bio if you're watching on Instagram. If you're on Facebook or YouTube, I'll pop a link down below so that you can do that. And basically the free discovery call will talk about how I'd be working with you, what we'd actually be doing, and whether we're a good fit as well, because that's really important too. So I'd like to thank you so very much for watching this evening. I really do appreciate it. If you're watching on my YouTube channel, be sure to like and subscribe so that you don't miss any future videos. And just so you know, I go live every single Wednesday evening, 7:30 p.m. Australian Eastern Standard Time, where I speak about something either hormone related or fertility related. So I really look forward to seeing you then, and thank you so much for joining me. Thank you. Bye.